Now we're going to talk about the shoulder socket and a whole separate problem from the rotator cuff. You've been diagnosed, you have what we call frozen shoulder, and your first question to me is, what's a frozen shoulder? Frozen shoulder is when the socket, which we know is the rotator cuff tendons and the joint lining, becomes inflamed. When it becomes inflamed, the shoulder becomes painful to move, and if you don't do your usual motion with the shoulder for a period of time, the shoulder will start to contract and develop scar tissue, which prevents the shoulder from moving. This is a cycle that can be very painful and cause patients significant dysfunction. This is the definition of frozen shoulder. Now, frozen shoulder is a general term, and there are two main types of frozen shoulder. Many people come in and ask, how did they get this? They don't remember falling down, having an injury to the shoulder. It just came on all of a sudden over a period of weeks. Well, this is the most common story for frozen shoulder. Frozen shoulder is also called adhesive capsulitis, emphasizing the word capsule. The inflammation to the capsule, or capsulitis, is the common problem no matter what type of frozen shoulder you have. The first type of frozen shoulder is the one we're just talking about, where there is no known injury or trauma. It develops on its own. The second type of frozen shoulder is where you've had a fall, a fracture, an associated injury like a rotator cuff tear, or even surgery, and the shoulder has become stiff and painful and lost motion. And the reason it's important to understand the two different types are that in the first type, where there is most likely no other problem in the shoulder but inflammation, the only treatment required then is inflammatory treatment, something to heal the inflammation. In the second type, where there is an associated injury or a trauma that started it, there may be a secondary injury that needs to be treated in order to finish the healing of the inflammation and restore motion. Now, that being said, no matter what type you have, the first type which had no trauma, or the second type that has an associated injury or trauma, inflammation is still the main cause of a frozen shoulder. And so we have to treat the inflammation. And the way to treat inflammation is with oral anti-inflammatories, things like ibuprofen and Motrin, ice, physical therapy, and if those are unsuccessful, commonly in frozen shoulder, the most effective treatment is to inject the Kenalog or Cortisone directly in the joint to heal the inflammation. I cannot emphasize enough how often patients don't want to do this injection because nobody really wants an injection, but they also are, after the injection, thankful for having had the injection because the treatment is very powerful. It reverses the painful process of inflammation. It can heal the inflammation in as little as a week. And once that happens, the shoulder will restore normal motion. In essence, it's sort of like taffy. When taffy sets, it's very, very hard to move it. But once you start to warm it up, it will stretch. The injection is what we use to start reversing the process. And so for most patients, the injection is the most important treatment, and it's important that we do it at the earliest point in the treatment. The second most important part of the treatment is that you do the necessary stretching exercises on your own and with a physical therapist to restore normal motion to the shoulder. And the two most important exercises to do on your own are first what I call the table stretch. And here you can see that if you put both hands on the table and are on a stool, which stabilizes your shoulder and keeps it square, you can easily find the stretching point, and you should hold the stretching point for up to 2 minutes. And the second exercise is what I call the wall stretch. Here, with your arm against the wall, at about chest high, you rotate your body onto the arm and you'll feel the stretch, usually in the back of the shoulder. These two exercises are extremely important. They should be done 5 times a day. A good stretch takes at least 2 minutes of gentle stretching in order to achieve a good result. And for most patients, I tell them that this takes at least 6 weeks for them to see a good result, and to be patient and to do them every day. If you do these 2 exercises, work with your therapist, and have had a good result from the injection, most patients will make a rapid recovery from frozen shoulder.